歡迎大家出席今日嘅簡報會。咁我台上邊兩位醫生分別係衞生防護中心傳染病處首席醫生歐家榮醫生，同埋醫管局總行政經理劉家憲醫生。首先請歐醫生。
Dr. Al would first brief us on the cases. Good afternoon. As of yesterday, there were 7,533 newly confirmed cases, case number 52837260369. Of the 7,533 cases, 3,229 were confirmed at the hospital authority. For the samples tested by the public health laboratory, of the samples tested, 20 cases carried the L452R variant. For the remaining cases, they either tested negative to 452R, or the case or the results were still pending. We received reports of 6,892 cases yesterday. Some of them were included in the tally of 7,533. We now invite Dr. Lau to brief us on the situation at the HA. Good afternoon. 3,803 positive or preliminary positive cases are staying in our public hospitals: North Lantau Hospital, Hong Kong Infection Control Center, the HA Infectious Control Center, and the Asia World Expo Community Treatment Facility. More than 2,100 patients are staying in the Penny's Bay Community Isolation Facility, and more than 200 patients are staying at the Community Isolation Facility of Dorset, Tsuen Wan. Over the past 24 hours, 13 patients who tested positive passed away, including 7 males and 6 females, aged 11 months to 97 years old. I'd like to talk about the 11-month-old baby. The baby girl experienced constant seizures, and on the 19th of February in the morning, she was sent to the A&E ward of Cheung Kwan O Hospital. The staff administered first aid for the baby girl, and a quick test shows that she tested positive. The baby was then transferred to the ICU in the pediatric ward of Queen Elizabeth Hospital, and she was transferred to an isolation ward. Her condition worsened, and her heart once stopped beating, and even upon resuscitation, she was still in a critical condition, and she passed away at 6:59 p.m. yesterday. Together with 3 other patients who passed away earlier, altogether 311 patients passed away in public hospitals. Another 260 patients recovered and were discharged. The utilization of isolation beds at public hospitals is 92%, which is at the limit. Another 40 patients tested preliminary positive upon admission, and about 60 patients in the same ward were classified as close contacts. And I have other matters to report. In recent days, we have been in discussions with private hospitals on transferring some patients to private hospitals. We are happy that the response from private hospitals has been very positive. We are now negotiating details, and upon confirmation, the arrangements could be implemented. Hopefully, this could be done in a matter of days. For patients who are recovering or receiving infirmary care, they would be transferred to primary hospitals, and under the public-private partnership scheme for those receiving day care services such as dialysis, they would be transferred to private hospitals. If they have the capacity, we hope we can work together and admit more patients. We would like to thank the support from private hospitals in dealing with the current crisis. We now proceed to questions and answers. Please identify your media organization before you speak.
From Bloomberg News. Can we have a bit more information on the 11-month-old baby girl that died yesterday? Do we have the specific cause of death, and is it from COVID, and whether it was the Omicron strain that was involved in this case, and any other risk to maybe the girl's family members? And my other questions have to do with the vaccination of the elderly. What is the government doing to speed up the vaccination program for seniors? And is there a priority being made in the government to get the elderly vaccinated quicker? And also, the Elderly Services Association of Hong Kong issued a statement refusing Dr. Sarah Ho's assertion that elderly homes have refused to take patients that were sent back from the hospital. They are saying that these senior patients were diagnosed with Omicron, and once they are sent back to the elderly home, they actually continue the transmission of Omicron within these homes, and they are stretched to the limit. So can you please respond to that claim? Thank you. Oh, sorry, last question. Do you have any information on how many of the deaths of the fifth wave were among people aged 70 years or older? Thank you.
For the case involving the 11 months baby, maybe Dr. Lau can supplement the clinical information later. About the question on the vaccination program, the government has been actively promulgating to increase the uptake rate of vaccinations among the elderly. This is very important as vaccination is one of the most important strategy in boosting up the immunity among the elderly as well as other populations in increasing the level of protections against COVID in the community as a whole. And for the Department of Health, the Elderly Health Services has been opening up some elderly health centers to provide vaccinations for the elderly so that they can, the members of the Elderly Health Service Centers can receive the vaccinations in a more convenient rate. And for outbreaks in the RCH residential care home for the elderly, the CHP will actively carry out epidemiological investigations and also to identify close contacts as well as arranging the cases to be sent to hospitals. And we will also liaise with the social welfare department as well as the hospital authority, the community geriatric teams to assess the conditions of the home and also the conditions of the preliminary positive cases, and we will provide advice on infection control as well as other issues in, for example, the management or arrangement of on-site quarantine, and also if indicator, we will liaise with the social welfare departments to send the close contacts to the AWE for on-site for quarantine.
For the 11-month-old girl, the girl has been all along have good past health. There are some family members, including her caretaker, her parent, her grandmother was found to have rapid antigen test positive at home, and the patient was stable all along until in the 4 a.m. 19th February. At that time, patient was found to have fever, and then he developed convulsion. Patient was brought to the accident and emergency department of Zhang Guanhou Hospital. At that time, she was intubated and was then transferred to the intensive care unit of the Queen Elizabeth Hospital. However, after admission, patient was started remdesivir. However, her condition deteriorated rapidly and has been found to have a cardiac arrest at the noon times of the 19th February, and he passed away in the evening yesterday. The case was referred to the coroner for further investigation, as the patient was just admitted for 1 to 2 days. We cannot identify the cause of death at this moment, and we will discuss with the parents as well as the pathologist how to carry out the coroner examination.
下一位，
I don't know. We haven't checked because the patient was just admitted on the 19th February.
下一位呢邊中間
Next question, please. The gentleman in grey, cable news. According to reports in the sanatorium hospital, there is a major outbreak. Doctors and patients have been infected across different departments, altogether some 30 of them. Is that true? In the sanatorium hospital, how many people are infected? What departments are affected? And are the patients in the sanatorium hospital aware of this? Why doesn't the CHP take initiative to announce major outbreak anymore? Is it because to avoid causing a panic? And how can the public avoid places with major outbreak anymore, if that's the case? And according to reports, there is a patient who has recovered after 2 weeks. He wants to get a certificate proving the case to avoid the vaccination. However, according to the HA, the exemption certificate cannot be provided, and he was asked to get a medical certificate from a private doctor. So does the administration have the mechanism to issue certificates to patients who have recovered at home? Because we have the vaccine pass scheme soon. Now, for a special school, Chongling, a third school in Changquanlo, according to reports, the school did not follow the instruction of the EDB to suspend face-to-face schooling, and staff are required to stay at the school to work. So is the CHP aware of the situation? And if that's the case, will enforcement action be carried out to make sure that the instruction is complied with? Now, according to RCHE, according to associations, residential care home for elderly members cannot take positive patients back. The government said there are outreaching teams to help them, but are there any other ways to minimize the infection risk within RCHEs? Now, about the sanatorium hospitals cases, I don't have any information. However, some of our cases are related to medical staff. Upon investigation, it is found that they are most likely infected in the community because, after all, they are part of the community. Because of the sheer number of cases in the community, it is not surprising that we have medical staff in medical institutions infected. We would arrange for hospitalization for each patient and contact the patient. Concerning major outbreaks, investigation and analysis would be conducted. Sometimes the process will be delayed. When we have major outbreaks in workplace or within an organization, we would recommend a thorough disinfection of the working place and suspension of work for some cases. Sometimes the further measures will be required. We also require a test for the staff members of the company, and we will take the initiative to contact places with major outbreaks. You mentioned positive cases who have not been hospitalized and then recovered. What about the exemption for vaccine pass? We are going to follow it up with the HA and the FHB. Previously, all the positive cases received treatment at hospitals. There were medical records for those cases. Now the situation is some patients are staying at home, and then if they are tested positive, they are tested negative on the 14th day with an rapid test, then they can leave. So it is only recently that we have patients who are not hospitalized. Now, Hong Chi Pine Hill School, it is a school cum residential home for children with special needs. School has been suspended. However, the hostel portion is still in operation. There are still students residing in the hostels. If there is an outbreak, we would definitely follow up the situation and arrange for on-site tests for students. The gentleman in the middle. Good afternoon, doctors. I'm from TVB. About the 11-month-old baby. On the 19th, she was sent to the Chengguan Hospital. But when was the onset, and how did he catch COVID? Was there a delay of hospitalization for the baby? Now, the CHP and the HA are not telling us the situation of critical and serious cases anymore. Given the higher number of such cases, would you consider telling us the situation of these cases again? Now, according to the mainland experts, details of the deceased patients should be made public in this press briefing to avoid the panic. So would you follow the mainland experts' advice about the public-private partnership? You said patients in convalescence would be transferred to public hospital, a private hospital. Do you mean COVID patients? If it is COVID patients, what is the criteria of transferal? And also, how many confirmed patients are still marooned at home? Yesterday, the HA said if these patients are tested negative on the 14th day by rapid test, then they can resume normal life. So can antigen rapid test replace PCR test? If patients cannot be hospitalized, then will the HA consider treatment at home? Now, about the Choi Wing Road Sports Center at Kowloon Bay, some elderly people are taken in. So are they close contacts, or are they preliminarily positive elderly patients? Are there screening or rapid testing in place? About the 11-month-old baby girl. According to the information we have, some family members were tested positive with antigen rapid tests, including her carers, her parents, and her siblings. I don't have any record of a PCR test being done prior to hospitalization. According to the family members, an antigen test was performed and the result was positive. The latest PCR test was done after to hospitalization. In the small hours of the 19th, she had a fever and convulsion, and then she was sent to the Chengguan Hospital. She was given a test and was found to be positive. The CT value was rather low, around 17. So we knew she was a COVID patient. The situation was serious. Intubation was performed, and she was transferred to the pediatric ICU in Queen Elizabeth Hospital. Besides difficulty of breath, she also had a convulsion, persistent one. So she was sent to the ICU, and then she was immediately given remdesivir. However, her situation deteriorated. At noon of the 19th, she had a cardiac arrest. CPR was performed, and unfortunately, at 1859 hours yesterday, she passed away. The incident happened quickly, so quickly. The case has been transferred to the coroner's court for investigation. That's all I have.
當然我哋知道以我所知就話佢哋係
As for her family members, they tested positive after receiving rapid antigen tests, and we have no other details. As for the arrangement to transfer patients to private hospitals, we have been in discussions with multiple private hospitals. Our plan is to transfer non-COVID patients. These could be recovering patients or patients who are recovering from surgeries. We will continue discussions with private hospitals with the hope to transfer these patients to private hospitals. This way, we can vacate beds and healthcare professionals to take care of newly admitted patients, including COVID patients. At the HA, we receive other patients, such as those suffering cardiac diseases or stroke. So there is a constant influx of different types of patients. Our frontline workers are doing their best to take care of all patients admitted to the HA system. As for the Choi Wing Road Sports Center, relatively old COVID patients who are recovering would be sent to this facility after being admitted to hospital. They would receive a test on the 7th day, and they can come home if the result is negative. If they stay in hospitals, they would be taken care of by our nurses, but they would occupy a bed that might be utilized by another patient with more imminent needs. So by utilizing this sports center, our patients can receive care at this facility, and in the process vacating beds for other more needy patients. The lady in black, please.
The RTHK. First of all, what do you think about another record high figure of over 7,000 cases today? And do you think cases will continue to go up? And to follow up on the 11-month-old baby, do you know why did her condition worsen so quickly over the night? And were the baby's parents, grandparents, and caretakers self-isolating at home on February 19th, whether the baby was infected by them, and were the family vaccinated? And for private hospitals taking in patients from public hospital cases, will they treat COVID patients in the future as well? Because now most hospital beds in public wards are full. Thank you.
For the overall trend of COVID-19 in Hong Kong, we observed that in the past 1 week, the number of cases reported every day is increasing very rapidly. So today we recorded over 7,000 cases, and also according to the number of daily notifications to the CHP, the number is also rising very rapidly. So we foresee that the number of cases will continue to increase in the coming short period, as judging from the trend of the disease. But we hope that after a series of control measures, we hope that we can the number of cases will drop in the later. But however, in the near future, we think that as the level of community transmission is still very high, and there is a lot of cases in the community, so the number will we expected that the number of cases will continue to increase and also remain at a very high level.
Since some of the family members of the baby was found to have rapid antigen test positive, we may believe that the baby may be infected while the family members. However, we haven't known the details of the family members. I mean the test. When was the test done, and what is whether they do the PCR or not. For the cause of the death, because the deterioration is very rapid, we still do not know the reasons of the death. That's why the case was referred to the coroner for further investigation, and we hope that we can find out the reason and around the coroner investigation. Sorry, what was the other question? Okay. At this moment, we will download or we'll transfer the non-COVID patients to the private hospital first. For example, after the patient received the surgery, some of the patient may need to have more rehabilitation, more training in hospital. At this moment, they are the suitable candidates to be transferred to the private hospital to continue the management. In order to vacate the beds for the more needy people, including the COVID patients.
下一位。
Next question, please.
Sorry, I didn't know.
下一位呢？
Next question, please. The lady in the middle. Good afternoon, Now TV. I would like to follow up on the 11-month-old girl's status. Are there other children or siblings infected? What about the situation of her family members? Are they in a stable condition? What do you estimate the source of infection is? The CT value is low and viral load is high. So what is the source of infection? You said she had a cardiac arrest. So for how long? Was the CPR successful, or did she pass away soon afterwards? And the other 12 deceased patients, how many were elderly people, and did any of them have underlying diseases, and were they vaccinated? About the private hospitals taking up non-COVID patients. How many private hospitals have enrolled in the program, and which ones are they? About the division of work, will public hospitals focus on COVID patients and private hospitals on non-COVID patients? And a question for the CHP. Yesterday, Dr. Zhuang said the number of preliminary cases will not be announced anymore. But today, we have a record high preliminary case number. So what do you think about the trend? How did you arrive at the some 6,000 preliminary cases? And why do you think that the number of preliminary positive cases will not help in analyzing the trend? About the baby, several family members have tested positive, including the parents and the grandmother and an elder brother and a younger sister, all tested positive with the antigen test. The elder brother is 8 years old. The younger sister, maybe she is a twin. Because we don't know the cause of death, we have referred the case to the coroner's court to find out more details. During the resuscitation process on the 19th at noon, her situation was bad. The resuscitation was successful. Her heartbeat resumed. However, situation continued to deteriorate, and she passed away, unfortunately, in yesterday's evening. The case has been referred to the coroner, and more investigation will be conducted. So besides the 11-month-old baby, for the remaining 12 patients who passed away, I don't have any more information. According to my colleagues, most of them were elderly patients. Some had chronic diseases, but I really don't have any more information, nor do I know if they were vaccinated. So since they have already passed away, it is late to talk about whether they were vaccinated. We just hope members of the public, regardless of their age and regardless of whether they have underlying disease, if you haven't got the first jab, you should do so as soon as possible. If you have been vaccinated, if you have received 2 doses, get a booster shot quickly. According to researchers, with a booster jab, the probability of complication and fatality would be drastically reduced. Some people can't be vaccinated. For example, the unfortunate baby. Then the family members should get vaccinated. Then protection would be offered to the unvaccinated. Now, children as young as 3 can get vaccinated. Elderly people and children are groups with lower vaccination rate. So I call out to the public to get vaccinated. In terms of division of labor, well, whether it is a division of labor, it is too early to say. But it is the beginning of a partnership. For patients who are suitable to be transferred to private hospitals, they will be transferred. For example, patients in convalescence and patients waiting for surgeries. This is a good start. Every day we have so many cases. We do have isolation facilities, so you may wonder why we don't just send everyone to isolation facilities. But with more elderly patients, more people need to be hospitalized, and more hospital beds are needed. If we can free up manpower and hospital beds to take patients in serious conditions, then that's a good start. I look forward to more collaboration with the private hospitals to benefit our patients. I would like to use the opportunity to clarify some figures. A reporter asked about our preliminary positive figures. Our usual practice was for preliminary cases from the hospital authorities and private sectors laboratories, they would be confirmed at the CHP's laboratory. So the confirmed case number is the number confirmed by us. So that's 7,533 today. We will continue to announce this figure. The previously announced number of preliminary cases are cases which were not confirmed yet by the CHP. These preliminary cases were waiting for the confirmation of the CHP. At present, in terms of private laboratories, HA's laboratories, and our laboratories, the number of samples is very large. So the number of unconfirmed cases does not reflect the trend in the past 24 hours. The more accurate number would be the daily reported cases. For preliminary cases, they would enter the HA system immediately. So we know the number of preliminary cases in the community each day, and for these samples would be sent to the CHP. For samples from the HA, they would be confirmed immediately. Sometimes there would be delay during the delivery of the samples to our laboratory, and then the cases would be confirmed only 3 days after. That's why we no longer announce the number of samples pending verification. Please refer to the number of preliminary positive cases or positive cases that we report every day. That would be more accurate in terms of gauging the trend. The gentleman there. Good afternoon, Phoenix News. A reporter has asked the hospital for new COVID patients, they would be sent to negative pressure ICU wards. But we don't know how many such wards we have in Hong Kong, and what about the occupancy rate. About the Pork Oil Hospital, after 2 patients have been infected, there are 30 more preliminary cases. How can the HA avoid such cluster anymore?
等我睇睇先啊。嗱，暫時我
Currently, there are 87 ICU negative pressure wards. 62 are in use. The usage rate is 71%. Not all of them are used on COVID patients, since some other patients need to stay in ICU negative pressure wards. Every day, we admit a large number of patients, and our colleagues are working very hard to take care of all patients. And since the conditions of patients would change anytime, our colleagues might not be able to report any changes immediately. Can you repeat your other question, please? The situation at Pork Oil Hospital. As we all know, the spread of the virus in the community is very serious. So basically, everyone could be exposed to infection risks. We conducted screening for all patients admitted to hospital before through PCR tests. We hope that could help identify and isolate positive patients so they would not infect other patients. We hope the work can be further sped up So apart from PCR tests, we might consider conducting rapid antigen tests. However, for those who do not carry a high viral load, they might not be caught through RAT. So at the end, we need to conduct PCR tests to confirm whether one is positive. Soon, all HA staff, especially frontline staff, would have to receive an RAT every day to protect themselves and patients. At the end of the shift, a staff member could be infected by a patient who tested positive or who is potentially positive. So through the rapid antigen tests, we can minimize any likelihood of them infecting other people. Apart from testing, we would take out appropriate infectious control, including the wearing of surgical masks for high-risk procedures. Full personal protective equipment must be worn. We also constantly remind our staff to refrain from gatherings and do not remove their masks unless they are eating. And that would minimize the risk of infection among our colleagues. Next question, please. The gentleman on the front row. I'm from AM 730. First of all, a question for the CHP. Will you no longer announce clusters with major outbreaks? Or can you tell us about the criteria under which you would announce such clusters? For those who are isolating at home till they test negative, you will follow up on them later. For those who have isolated at home for 14 days or close contacts, would you follow up on their isolation proof or sick leave certificates later? So how can they explain the matter to the employers? For the Choi Ming Road Sports Center, you said it's for patients who are about to be discharged, but according to the press release of the SWD yesterday, it is for elderly people who are waiting to be admitted to the HA. Can you give us an update on that in terms of the public-private partnership program? How many patients are expected to be transferred, and how many beds and how much manpower are expected to be released as a result? In terms of major outbreaks, we would admit every case as soon as possible, but inevitably there would be a backlog of cases. Since there are too many cases in the community now, we are seeing outbreaks of different scales at different locations, including residential care homes. So we are paying particular attention to outbreaks at residential care homes because they involve the elderly and persons with disabilities who are likely to see complications. That is why we would give priority to these groups. As for outbreaks at other locations such as workplaces, we understand that there were outbreaks, and we would recommend the relevant companies to carry out disinfection and to test the relevant staff. For major outbreaks that involve a large number of cases, we would recommend the premises to close for some time till all the staff members test negative. And even after the resumption of work, the staff would need to be tested every day. Some recent outbreaks include the Shengshui slaughterhouse. Since last week, there were close to 100 cases. For some construction sites, such as the Changquano Lamtin Tunnel site, we recorded a large number of cases. So through the Transport and Housing Bureau, we recommended the construction site to close for 7 days from last Saturday, and all relevant staff had to be tested. We would continue this line of work for major outbreaks. For those who are isolating at home, there are cases in which people could not be admitted to isolation facilities swiftly. So after receiving such reports, we would issue recommendations to the patients. So after receiving the SMS, these patients might not necessarily receive our call right away, and they would need to wait at home. So from yesterday, we were aiming to speed up the processing of these cases. So in the next 2 or 3 days, we would distribute information kits and test kits for those who are waiting to be admitted, and these kits would be distributed to their home contacts as well. We would also set up an online platform to collect the particulars of the home contacts of these persons who tested positive or preliminary positive, and we would issue a quarantine order. The government announced yesterday that from today, for all preliminary positive cases and their home and their household contacts, the government would distribute an electronic wristband as well as information and test kit. Upon receiving such reports, the CHP would first collect the preliminary data of the patient, including the number of household contacts and their place of residence, and the information would be transferred to relevant government departments, who would then distribute test kits and information kits through logistics companies. And hopefully the patients can receive the info kits and test kits as soon as possible, and hopefully they would patiently wait at home till they are admitted.
大家都明白啦。
About the Choi Wing Road Sports Center, some patients visited our A&E departments. Hospitalization could not be arranged, and they could not return to the home or the care homes. Some RCHAs are experiencing outbreak, and all in the care homes have to undergo quarantine. So in theory, they have to wait for hospitalization. However, our rooms are full, so we have found places in the hospital, for example, resting rooms or physiotherapy departments or day hospitals, and to accommodate these patients first. That's the purpose of the Choi Wing Road Sports Center. It has taken in the first batch of such patients. They need care rather than treatment. We have experienced non-profit organizations providing daily care for these patients. If these patients fulfill the discharge criteria, or if they have a place to return to, then they will go home or go back to the care homes. Some patients, however, still need hospitalization. We have to vacate the beds in the hospitals to take these patients. That's why we are shifting the beds around. For patients who are ready to be discharged, but they are still staying in the hospital because of numerous reasons, and they need care rather than treatment, then they would be arranged to the Choring Road Sports Center to receive continuous care until they can go home or return to the RCHEs. So there are two types of patients. I'm not saying we haven't changed the discharge criteria. The purpose is to arrange suitable patients to suitable places to receive suitable care or treatment. Those patients need care rather than treatment. There is no place for them to go to, so the Choring Road Sports Center is serving this purpose. Public-private partnership. Like I said, we are negotiating the details and the model with private hospitals. What kind of patients to transfer and when we can start. We are confident that the program can begin soon. I don't have the specifics right now. Details are still under negotiation. We have a dedicated team under the HA to hammer out the plans with private hospitals, including infirmary care, convalescence, or even surgeries. We hope that more patients will benefit under the scheme, and we can free up more beds for patients. And besides public-private partnership, we also hope that private doctors or retired doctors and nurses can join the HA team in providing care for patients at the Asia World Expo, our infection control center, or even public hospitals. We need more hands to help us fight the epidemic. Next reporter, please. The gentleman at the back. Good afternoon, Hong Kong 01. Now about the deceased patients today. Were they vaccinated? Were they chronic patients? Were they Omicron or Delta patients? And how many patients are still at home today? How many of them have fulfilled the 14th day negative test at home and can roam free again? And will the HA perform a PCR test for everyone in the hospital, including medical staff and cleaners? My apologies. I can only tell you that in the past 25 hours, 7 males and 6 females, including an 11-month-old female baby, have passed away. They are from 11-month-old to 97 years old. Beyond that, I don't have any more details. This is a warlike period, and our staff are providing care for the patients, and we cannot update the information in a very timely manner. We cannot approach and ask each and every colleague. It takes time for our colleagues to input to enter the data into our system. So please understand the situation. We will give you every detail we have. About test, in the near future, we will perform a daily pre-shift test for our clinical staff. Say if it is the morning shift, then before entering the ward, a rapid antigen test will be performed to ensure that the colleague has not been infected before caring for the patients. The reason is that the situation is serious in the community, and every day we need to go back to the community. So we want to prevent our colleagues bringing in virus from the community into the wards and infect colleagues and patients. So in a few days' time, we will have more details. All colleagues will be required to undergo a rapid antigen test before the shift. Next question, the gentleman in a black mask. RTHK. Now, many people are tested positive at home, and they have babies and infants, family members at home. So, under what situation should these babies be hospitalized? Some babies have fever, and they were taken to the ANED, but still the ANED did not take them in. So if family members are infected and the baby might be infected, how will the HA deal with it? Under what condition will the HA take them in? Now, many people are performing the rapid test themselves. There are different brands in the market. Some people told us that they got different results from different brands of test kits. So can you provide them with a trusted list and on what brands to buy? And some people are buying proprietary Chinese medicines themselves to prevent infection. So would you support? So would you endorse this idea? Is it safe? About the rapid antigen test, as the Department of Health website, we have published a list of recognized rapid antigen test brands. So if you need it, we can send you the link. For rapid antigen test, under the Stay Home Safe scheme, if you are tested positive, we advise you to call the HAD's hotline. The colleagues of the HAD would call us, and we would arrange with the hospital authority to hospitalize the preliminary patients. And also for close contacts who are household members of the case, we would provide them with the information kit about the proprietary Chinese medicine. First, about children. There are different guidelines out there in terms of care for children. Now, I have a guidelines published by the Hong Kong Pediatricians Association. That is there's a trusted authority in Hong Kong. A pamphlet is published about methods to care for young patients. If the young patients experience difficulty of breathness, purple lips, palpation or fast heartbeat, unconsciousness, persistent fever, convulsion, or difficulty at eating, the patients should be hospitalized immediately. For low fever, not necessarily COVID. Many parents have experienced children having low fever. There are different methods to lower the fever. For example, a warm bath or cooling pads. So persistent fever is one of the warning signs for immediate hospitalization.
我哋永遠收唔收一個病人入院咧，我哋係講。
In deciding whether to admit a patient, it is always a clinical judgment. If the entire family of the patient tested positive, then we know that he or she is already a COVID patient. And if the person exhibits symptoms, and upon investigation of their medical history, blood tests, X-ray scan, etc., the doctor will consider a host of factors. And in deciding whether to admit a patient, we would decide whether treatments in hospital are needed So this is a complicated process that takes into account a number of factors. The doctors would analyze different factors before deciding what the best course of treatment is for the patient. Final question for the day, the lady at the back. Can you repeat your question about the proprietary Chinese medicine? The speaker is not coming through the microphone.
我諗食任何藥物之前，
Before using any medicine, one should seek advice from doctors. So for people suffering a low fever, normally people would take a rest at home, drink water, and take more rest. And if necessary, they could take fever medicine. But if you exhibit consistent and multiple symptoms such as shortness of breath, chest pain, stomach pain, etc., I believe a lot of information is available online. And if you exhibit acute symptoms, you must seek medical condition. So please do not delay the proceedings. As to whether medicine should be taken, well, for Chinese medicine, the advice of Chinese medicine practitioners should be sought. I'm from the Hong Kong Economic Times. First of all, a question for Dr. Ao. You said the government would come up with ways to help compile proof for patients who are waiting to be admitted at home. So after receiving the information they submit, would the data be verified before generating the proof? And would it take a long time to compile the proof for them? You said an online platform will be created very soon. But if certain employers or companies do not accept proof from this online platform, then what can the patients who stay at home do? Now a question for Dr. Lau. In recent days, the numbers of healthcare professionals who tested positive were not announced. We saw consistent highs earlier. Does it mean that too many healthcare professionals have tested positive, and as such you could not catch up with the numbers? You have urged private healthcare professionals to join the locum program at HA. How many healthcare professionals have been hired so far? As for public-private partnership, can you guarantee that no extra fees would be charged for the services? Dr. Ao, do you know how many residential care homes for the elderly experience an outbreak so far? As for confirmed cases and their household contacts, for those who tested positive or preliminary positive, the government's current policy is to admit these patients in hospitals or community isolation facilities. So upon receiving these reports, we would identify their address and the number of household contacts first. And the information would be passed on to relevant government departments so that the preliminary positive patients and their house contacts would receive information kits and rapid test kits. For confirmed patients, the HA would be informed as soon as possible, who would arrange for admission to public hospitals or community isolation facilities. And we would also issue a quarantine order once we learn about their destination. In case we cannot get in touch with them immediately. At times, we might not be able to collect all the information right away. That is why we are creating an online platform to collect the information within a short time. We would analyze the cases and issue home quarantine orders. This platform is yet to be released, and we hope it could be live very soon. After verifying the information we receive through this platform, we would issue a quarantine order for each household contact. They would have to go on home quarantine for 14 days. Since we are facing numerous cases, we would first distribute information kits, and upon receiving their information, we would issue a home quarantine order for household contacts as soon as possible. So before completing home quarantine, these household contacts should receive our quarantine order. For confirmed cases who could not be admitted to community isolation facilities within 14 days, so if after 14 days the RAT result was negative, then they would be considered recovered. For confirmed patients who are never admitted to hospital, we would discuss with the HA how we can compile the medical proof for them. We have no statistics on the number of people who recovered before being admitted to hospitals. For residential care homes for the elderly, as of last night, the number of RCHEs or RCHDs with outbreaks of cases were about 250, and in the past few days, we received a dozen or so cases involving staff or residents of care homes or facilities with minor outbreaks, and they are under investigation. And of course, our staff are extremely busy. It's very hard for them to consistently update the numbers. From the 9th to 18th of February, 829 healthcare workers contracted COVID, and we have no updates since, and I call for everyone's understanding. I believe the latest number is now higher. Like we said, healthcare professionals are part of the public. If many people in Hong Kong have tested positive, inevitably more of our colleagues would test positive as well. So that is why we hope our colleagues would do an RAT every day before reporting to work, so that they would not take care of patients if they contract COVID. Since we call for more healthcare workers who are retired and in the private sector to come back and help, we receive a lot of inquiries and applications. I don't have the exact numbers, but we did streamline the application and vetting procedures so that more healthcare professionals who want to help can join our service quickly in order to render support to patients. That could help alleviate our workload.
嗱，以往
About the charges for the public-private partnership scheme service. We have different packages every time. In the previous 2 waves, we have a similar arrangements for people who experience a bone fracture because of the closure of more than half of our A&ED. For patients requiring emergency orthopedic operations, they were referred to private hospitals, and they are charged under the public hospitals charging scheme. When we have more details, we will make them public. In accordance with our previous practice, if patients are transferred to the private hospitals because of the public hospitals situation, no extra fees will be charged. That's the end of the media briefing today. Thank you. Sorry, the speaker is not coming through the mic. Sorry, the speaker is not coming through the mic.
Sorry. You mean death? Three. Sorry, I haven't this number at this moment. Sorry. 我冇呢個
I don't have the information right now. Sorry. Local cases. I'm sorry. Today, we have 3 imported cases. The remaining are local cases.